So, hi everyone, and here I am back with the Saturday awareness session, which we do with Game of Thrones family uh, to tell them about, a lot of diseases, especially we women carry. All right, and I got 5 minutes late because we were fixing the network issue with Dr. Huda, and yeah, she's here already. And
Okay.
as you can see, she's still in her hospital. And hi, Huda, good to see
Yeah.
you.
Sorry.
I know you are a very, very busy woman. I'm sure you must have done some operation or some delivery and you are here. Still, thank you so much that you are here. And
Thank
you can hear me, Huda, right?
Yes, yes, I can. Can you hear me?
Yes, yes, clearly. We can hear you
O-
clearly. So,
Okay, fine.
Huda, when you know very well, any nutrition professional, or in your case, you're a renowned gynecologist right now. So, what is the prevalence of PCOS in women? And how does it develop? Okay, back. I am back now. Yeah, Huda is also back now. So, Huda, a few things that we would like to know from you as a gynecologist. How often do you meet women with PCOD? Every day, or how it is? How prevalent is this disease? And how does it develop? A lot of women messaged me when they came to know that I'm doing the session with you, that how it develops actually. And how can we, prevention part I will also talk about. But can you tell us that how prevalent it is? What does it do to us? How can we protect ourselves? Over to you,
Yeah.
Huda.
PCOS, as we all know, this is the most common, the commonest endocrine disorder we can say, and we have been seeing a lot of cases, especially the prevalence. You can say it is around 20 to 30%. And again, it differs in every ethnic population, and so we can say that we are having around 25 to 30% of prevalence in South Asian. It is more common in South Asian population,
Okay.
especially countries, so this is more prevalent in our countries uh, compared to Caucasians and all. So we have the more number of PCOS cases. And also the cause, that is again, the cause is not very well known. We have a lot of theories behind it. It can be genetic. There can be some family history
Mm.
also, and also, uh, as I said, it is more common in South Asian population. What is We all know that India is called the capital of diabetes.
Very true.
So yeah. So what happens is, the another cause what we see is the insulin resistance. See, insulin is a hormone which is produced in the body. Okay, so we all need insulin to keep a balance of glucose. So what happens here is, there is, and the cause is, because of insulin resistance, the insulin what we produce in the body is not acting upon our cells to control the glucose. So this in turn will cause the insulin should act on the cells. This
Correct.
insulin, what we have in our body, should act on the cells. Now this is not acting. The cells are not accepting this insulin. So there is a lot of free insulin in our body, in our blood. So this insulin will give rise to some changes in the sex hormones. So what we see in PCOS, as we all know, so these sex hormones, the balance of the female and male sex hormones, no, so that gets deranged. So we get more of male sex hormones, which is the testosterone. The levels of testosterone start increasing because of this insulin resistance. So this is one of the cause, and there could be some other causes which are not there under study. That is why the treatment also is, it is individualized. The treatment is individualized. Not that all PCOS will not have the same kind of treatment.
Okay. So that was a great information. What Dr. Absar Huda is saying, that insulin resistance is something that gives rise to a disbalance in the male and female sex hormones. So generally,
Yeah.
she's
One of the
telling
cause.
South Asians. South Asians means you want to say that we women, especially being Indian, obviously we are more prone to it. Correct?
Yes, definitely we are more prone to it.
So how to protect ourselves from then? If we are more prone to it, then definitely we have to protect ourselves because as first we would like to know from you what happens when we get PCOS, what all kind of symptoms you see, so that because Huda, you know, a lot of women are there who are not even aware that this symptom is of PCOD. Maybe they experience mood swings, irregular dates, missing dates, more and more belly fat, but they are not even aware. So can you tell us, typical symptoms, so that if someone who is watching us, if they notice this symptom, they should check with a doctor. What are the symptoms basically?
Yeah. All we do we have any other participants in the talk now?
Right now, yes, people are watching us, they have some questions for you, but they cannot come in the studio, only me and you in the studio.
All right. I mean, can they send their questions? I just wanted to have an idea, what kind of questions they have,
Okay.
what kind of misconceptions they have, what do they actually want
Okay.
to know,
Yes, I
what is
can
the
read it
idea
out for you. I can read
because
it
everything
out. Yes.
about PCOS. I just want to know
Okay. The first thing
what
that
we
women
have
want to know
PCOS.
is, one question is that how to, most of them want to know how to protect ourselves from it. What can they do in their daily life so that they can
Yeah.
protect themselves? One more question that we got a lot of, like mom of teenage girls. As you
Yes.
know, this
Yes.
generation, no
Yes.
matter how
Yes.
much you educate them about junk food is not good, do not eat this, but you know very well, you also must be a mom, you know they will not listen. And especially girls, how to
Yeah.
protect these girls, what habits we should give to them so that they are at least, protected, or
Yes.
what are the symptoms they want to know, so that they, if I feel like that, then I check with the gynecologist that what happened.
Right.
On what
Yes.
preventive measures, diet and exercise are preventive measures that I will talk about. You can talk about the, a doctor's perspective.
Yes, okay. Let me explain to you people as to what actually PCO is. PCOS, the full form is Polycystic Ovarian Syndrome. So it is a syndrome. It is a spectrum of disorders. Okay. So there can be varied presentation of PCOS. Some people have some kind of symptoms. Some people will have some other kind of symptoms. So not that everybody will have the same kind of symptoms. So usually what happens when we diagnose PCOS is whenever there is the ovaries, every woman has two ovaries, okay, attached to the uterus by the tubes. So these ovaries become bulky. Bulky, the size of the ovaries increases because of lot of fluid filled, small fluid filled spaces in the ovaries. Okay, so when we diagnose by ultrasound, so there are three criteria for PCOS wherein you have to diagnose it by ultrasound. We have to really see the cyst there and the size of the ovary. Also, plus there should be the girl should be experienced, the girl or woman, because it can come at any age, any reproductive age. Okay, and what happens
So
is
Huda, sorry to interrupt, Huda, but at what age do you think it will come up? Any like 12, 13, 16, 18, like that?
it can come at that age also, but most commonly from a reproductive age, like 20 to 40, we can say.
Okay.
All right, but earlier than that, any reproductive age, after her menarche, like when she attains menses, after that it can come, but more commonly,
Okay.
usually like 18 to 40, we can say anytime it can develop. All right. The other thing is what I was saying. That's one is we have to do ultrasound to know whether really the ovaries are bulky, there are cysts in that, any other problem is there in the ovary. One thing. Other thing is there will be, as I said earlier, there will be derangement of hormones. We will have, even the girls will have testosterone, but at a lower level because of these polycystic. In polycystic syndrome, what happens is the testosterone levels will increase. When this level increases, there will be a lot of androgenic manifestations because of this male sex hormone, which is in the higher quantity than normal. So what happens? Because of this, people will start developing hair in unwanted areas like over the chin, upper lip, or lower abdomen in the midline, back, where usually female will not have hair growth there, and this hair growth will be little thicker. All right.
Mm-hmm.
So
Correct.
these are the
Yeah.
symptoms. This is nothing. This is, as we call in medical term, it is called hirsutism. So these are the symptoms of male sex hormone, wherein we will find hair growth like this. Okay, and and there won't be any other what do you say, because of this PCOS. There won't be male physical characteristics as such. When we have this, it is some other disorder along with
Okay.
this. There could be small, breast will reduce in its size. So these are not the symptoms of PCOS. There will be extra hair growth, you know. And if at all you find the growth is reduced, there is muscle bulkiness is there. In that case, we will have to think of some other disorder, some other tumors, or some other disease. In PCOS, this will not happen. Only hair growth will happen
Okay.
usually. There can be in other disorders when there is like there can be tumors in the body which produce male sex hormones. It is not the case of PCOS. There can be deepening of the voice, change in the texture of our voice. So these things do not happen. What I mean to say, because of the little increase in the male sex hormones in the blood, so there can be hair growth. So this is one criteria for it. Another thing is that menstrual problems will be there, as this is the main problem what we see everywhere. Okay, so what we usually for regular menstruation will not happen. The regular cycle is usually, we don't have to worry. When the regular cycle is, you can take it as 21 to 35 days or even 40 days for that matter. Some people can have periods in once in 35 days also, or once in 40 days also. But when it exceeds more than 40 days, say you have day one of your cycle, I mean, for example, if you have menses today, that is considered as day one. So from today, if you do not bleed within 40 days, so then it is considered as little abnormal. Then we will have to investigate. All right. So now what we know is like PCOS. Usually, when PCOS is there, it is whenever there is obesity, whenever there is overweight or obese patients will have are more prone to get PCOS. But that doesn't mean that there are no lean PCOS patients. PCOS can happen even in lean PCOS patients. But when she has PCOS, we have to be very careful that she might gain weight. Okay. And it is not always that, see, when we come, or you must be facing that, नहीं नहीं मेरे को PCOS है मेरा weight reduction नहीं होगा. That is not the case. Because of PCOS, तुम्हारा weight reduction नहीं होगा. This is not the case. PCOS, just because of PCOS, you are gaining weight. No, there is no strong evidence for it.
I was coming on this point because this is all I hear all the time. मुझे PCOS है, मेरा weight loss होगा क्या? I tell them, बाबा आपका भी weight loss होगा. There is no relation. But Huda, this has gone so much deep into the mind of
Exactly.
people that
Yeah.
they find it difficult to believe.
We can say that it is a lame reason then. क्योंकि PCOS है इसीलिए मेरा weight नहीं reduce होगा, ये भी नहीं है. और दूसरा क्या है? One is that there is no strong evidence for it कि PCOS की वजह से ही PCOS की वजह से मेरा weight कम नहीं होगा. Another
Correct.
thing
There is
is
no evidence. Correct.
there is no evidence for it. And also one more thing is तुम्हारे ओवरवेट या ओबेसिटी होने की वजह से मुझे पीसीओएस आया, ये भी नहीं है.
Correct.
Yeah. Okay. So usually that is one of the causes. Okay. So so more commonly, but then what we have to be careful about is what are the consequences of PCOS. अगर किसी में PCOS है तो what are the consequences, what problems they can have later. So one thing is she is not ovulating every cycle. Okay, a woman in her reproductive age group, after she attains menarche, she should ovulate every month. As I said, 21 to once in 21 to 40 days, she has to ovulate. Okay, so that is the a normal phenomenon. But then when this is not happening because of PCOS, we have to see to it that she ovulates at least once in 3 months.
Okay.
Okay. कभी कभार क्या होता है, पीसीओएस है, उसको पीसीओएस है, ब्लीडिंग नहीं हो रहा है, मेंसेस नहीं हो रहा है, नो वी कैन नॉट कीप क्वाइट. All right. Why? If you don't bleed at least 4 times in a year,
Okay.
those who are having PCOS problem will have this irregular cycles, delayed cycles. No, so you can wait for the young girls. I'm telling you can wait up to 2.5 to 3 months. Up to 3 months you can wait. Okay, if she doesn't bleed till 3 months, she has to take some medications and bleed, because if this is not done, the thickening, because she does not bleed, the inner layer of the uterus can
Yeah.
thicken, can enlarge, and it can lead to the cancer of endometrium, that is the cancer of the inner layer of the uterus later. Okay, especially in those people who are overweight, who do not have children, who have diabetes along with that. So such cases. So this is one thing which is important for
Very, very
the,
important to that. I think it's very, very important because if
yeah,
you are a mom of to a girl or if you yourself, we cannot.
yeah,
She's telling us we cannot keep quiet because the
yes,
risk is huge. I mean, developing endometrial cancer, it's a huge, huge risk that we have, right? Because
yes,
we only have that organ. So risk also is for us only. So the frequency that she's telling is very, very important for all of us. Please take care of the dates. She's telling 3 months. She's telling the time frame. She's telling these things, friends. Nobody else will tell you outside, but Dr. Absar is so, she's such a server and a good friend of mine that she has agreed to come and share these frequencies. I think it is
yeah,
going to help a lot. And she's telling three things to be watchful for, right, Absar? Unwanted hair growth. 40
yes.
डेज में अगर नहीं होता है ब्लीडिंग तो आपको
हाँ.
थोड़ा सा चिंता करना है कि क्यों नहीं हो रहा है.
Start investigating, yeah, कि क्यों नहीं हो रहा है,
एंड देन
what is the
हाँ,
behind it, because
और एक
it
बहुत
is
बड़ा
normally,
मिसकॉन्सेप्शन ये है कि हम मैं बहुत
हाँ,
दुबली पतली हूँ, मैं फिट हूँ तो मुझे पीसीओडी नहीं हो सकता. देन अगर पीरियड्स नहीं भी आ रहे हैं देन आई कांट कीप क्वाइट इवन इफ यू आर आइडियल वेट इट इज नॉट द केस. And again
yes,
she is telling, I also keep telling to everybody, पीसीओएस का वेट से वेट लॉस से कोई रिलेशन नहीं है. पीसीओएस होने से भी वेट लॉस होता है, हाइपोथायराइडिज्म होने से भी वेट लॉस होता है.
yes,
So I hope when you are listening from a gynecologist, you will believe this, that this is the reality. And she's telling us कि consequences क्या होते हैं. She told about endometrial cancer. And now, doctor, we would love to know कि इन सब से बचा कैसे जाए. ये सब तो बहुत ही डेंजरस है, अच्छा नहीं है. तो हम डेली लाइफ में ऐसा क्या करें कि ये हमें ना हो.
yeah. I would like to add some more consequences,
Yeah,
Shruti,
please,
because
please. Yes.
important
I
things
was
also.
thinking about your time. That is why, if you are free, we would love to hear from you.
Yeah. So the what I told you about endometrial cancer, if she does not bleed, see, if she bleeds, even with the medicines, we give some tablets which will cause withdrawal bleeding. So at least once in 3 months, if she has her periods, then we don't have to worry much about this endometrial cancer or whatever. So other, if she does not bleed at least 4 to 5 times in a year, then there is a small risk of endometrial cancer. एंड हाँ, अभी पीसीओएस होने से देयर इज नो रिस्क ऑफ ओवेरियन कैंसर. वी डोंट हैव टू वरी अबाउट हाँ इसमें कुछ और कुछ हो जाएगा, ये ऐसा नहीं है. ओवेरियन कैंसर हो या ब्रेस्ट कैंसर हो, these are not related to PCOS. All right. Another thing what we have to worry about this, as I said, insulin resistance. These people are very prone to get diabetes later on.
Yeah, that is a big, big, big risk we carry.
Problem. Diabetes later on. Also, uh, uh, gestational diabetes, which is diabetes during pregnancy, which is very harmful to the baby.
Yeah.
All right. So, as this is another consequence. Another thing is that because of these insulin resistance and she developing diabetes, we can have a small risk for heart disease also, because these are all interrelated: diabetes, high cholesterol levels, hypertension. Uh, these are all interrelated. And just 2 seconds to be just.
Yeah, sure, sure. We know. Guys,
Yeah.
she's handling many things in between. Yeah, please go
Okay.
ahead with that.
So these are so there can be a small risk factor for heart disease also when there is PCOS. Okay, the major concern is diabetes. All right. So as you said, prevention is forget when I talk about prevention and the treatment is almost the same. The first line of treatment for PCOS patients is diet and lifestyle modifications, diet and weight reduction. Even see another problem, biggest problem with PCOS is infertility. When
Yeah,
she's
this
not,
I was coming to. A lot of women are asking, sorry to interrupt, that if I
yeah.
have PCOS or even I was detected years earlier, will I be able to conceive normally? Are my chances of conceiving through IVF higher than the other women? That is what they want to know. कि conceive हो पाएगा natural या कोई
If you
problem
are,
होगी अगर हो भी गया तो?
yeah, if you are having PCOS compared to normal women, the chances are little lower. Not that you cannot conceive.
Okay,
All right. So whenever there is PCOS, there is a chance of infertility. You need some treatment for that because first of all, you're not ovulating. Every cycle, you're not ovulating. You're not producing an egg every month. All right. So we might have to give some medications to produce an egg, for the egg growth in PCOS. But
but it's
this,
manageable, Huda. It's manageable. We can manage the condition.
yeah, I'm coming to that. But these
Okay,
medications for infertility will act if you reduce weight.
okay,
So the first line treatment before even starting medicines for infertility in PCOS cases is is weight reduction.
okay.
Weight reduction in obese, overweight PCOS cases, and in lean PCOS cases, she can later on have weight. I mean, she can gain weight. So in them, prevention of gaining weight. In these people, reduction of weight gain. So actually, and one more thing, more of truncal obesity is seen in these cases in PCOS. It's not the leg and hands and leg, what
Yeah.
fat, that doesn't matter much. What we see is truncal obesity. Truncal obesity, I mean to say that is the abdominal obesity, means that's why waist circumference. So you might have
Yes.
seen what we ask for is waist circumference. So the
Correct.
waist circumference ಕೂಡ್ಲೆ ಬರ್ಲಿಕ್ಕಿಲ್ಲ. Waist circumference should be less than 80 centimeters. PCOS affects this truncal obesity, waist
Yes.
circumference. So this is what is very important. And even when you lose at least 10% of your weight, 10% of weight, that means you have lost, along with that 30% of your waist circumference or the waist obesity will be lost. When you lose 10% of weight, overall
Very true.
weight, percent of what do you say, truncal obesity is reduced. So that is why these brisk exercises, at least 1 hour per day for these patients, and the diet control is the same for everyone, the overweight PCOS patients and other overweight or obese patients. The diet control is same. The diet modifications are the same. There is no change in that. All right. And another thing is when you reduce weight, at least 5% of weight reduction will increase your fertility. 20%, 20 to 30% fertility will be increased. Then the whatever the drugs are given will act on it. Otherwise, it will not act on it. It won't help you. Moreover, along with that, other complications of obesity on pregnancy will be there. You will have miscarriages and other complications like that. All right. So even 5 to 10% of weight reduction, we have seen patients along with that spontaneous correction of their menstrual cycles. Automatically, without any medications, they will regularize themselves and the fertility chances will increase. And prevention, yes, uh, avoiding junk food, maida, sugar, even for children. What we do is हम लोग 40 साल के बाद में डाइट और एक्सरसाइज शुरू करते हैं. इवन डाइट
Very
डाइट
true.
हाँ, इवन फॉर द चिल्ड्रन, ये वो जो शुगर मैदा, दिस अप्लाइज टू योर चिल्ड्रन ऑल्सो. दिस इज व्हाट
Yes.
वांट टू स्ट्रेस अपॉन.
Yes. So, Huda, a lot of women, this problem, infertility wala. This is
Hmm.
such a big stress in their life. उन्हें लगता है कि एक बार ये हो गया तो अब मेरा कुछ नहीं हो सकता, अब मुझे ये करना पड़ेगा। इनफर्टिलिटी का प्रॉब्लम बहुत ज्यादा, मतलब उनके दिमाग में बहुत ज्यादा मिसकॉन्सेप्शंस हैं। दैट इज व्हाई आई थॉट टू इनवाइट यू एंड टेल देम। सो शी इज क्लियरली टेलिंग फ्रेंड्स that it is manageable. You do waste, reduce the truncal obesity. 30% chances of your ovulation will increase. Then doctors will give you medication. That medication will start working, and then your chances of getting conceived is more. So, Huda, it's
Yeah.
manageable. That is what you want to say, right? Is there, should I lose
Yes.
heart? Should I be very sad that I got this? No need, right?
PCOS is one of the causes of infertility. There can be lot many other causes that can, there can be tubal causes, there can be uterine causes, there can be male factor in infertility.
Yes,
This is one
very
of the
true.
causes, much more treatable, compared to other causes. Also, uh, in infertility, when we induce ovulation, that is what is the medications for. As I said, reduction of weight. One more thing is the age, because the ovarian reserve goes on. We people have heard about menopause. Menopause age, the age of menopause is from 45 to 55. So menarche से it starts. तो जो ovarian reserve है, every year it goes on decreasing. So especially when PCOS is there, you have to conceive early. You cannot delay your pregnancy. So that is another important thing. Age is the main factor in treating infertility patients, because when age is on our side, the treatment also will help. So below 35, you, and especially when PCOS is there, you have to try to conceive early.
Huda, lot of thank you messages coming for you. Thank you so much, ma'am. Thank you so much. Very informative. Such an excellent topic. You are telling us so nicely. So, lot of thank you messages for you coming our way, and they are getting to know that when they should get worried and when not to get worried. So, doctor is giving a very clear message. It is one of the most treatable cause of infertility. Infertility is not only about PCOS, ladies. Infertility has a lot of other factors too, and she is telling it is much more treatable than other factors. So I don't think we should lose heart, or we should feel very sad, or we should, take a stress in our. There is no point taking a stress, right? She anyway told that, if we take a stress for this point, it will increase our chances, right, getting diseases. So
PCOS
she's.
needs a holistic approach. I mean, it's not only gynecologist treating you. Gynecologist will deal with your menstrual problems and the infertility problems. Um and you need dermatologist for your skin problems, the hair growth problems, and you need dietitian, you need psychologist, psychiatrist. So this is a holistic approach. So, and awareness is very very important. And you take whatever treatment, I don't say only allopathic treatment, ayurveda, unani, homeopathic, whatever treatment you say, my take home message is you have to, any PCOS patient, in your family or in your friend circle, she has to bleed once in 2 to 3 months. If there is irregular periods, some people will have heavy bleeding, heavy, irregular cycles, heavy bleeding. They can be given cyclical hormones. Another thing is if somebody is taking treatment for hair growth problems, then they have to be careful about the conception. They cannot conceive because that can cause adverse effects on the child. So that they have to be careful about whenever they're taking any treatment for any drug treatment for their hair growth, hirsutism problems. So this is another
मतलब
important.
बहुत सारी चीजें हैं जो रिक्वायर्ड है. Holistic approach, that what you are telling, right? Whenever you are
Yeah.
facing more problem, take help. So idea is to
Yes.
take help. Idea is not to keep quiet, sit at our home and getting stressed. Get to the professionals, take help. And she is telling very clearly that it is manageable. If it is manageable, why to worry about it? We will put our
Exactly.
best effort to manage it.
I have seen patients spontaneous treatment without any drugs. only counseling of the patient for diet and lifestyle modification, diet and exercise, and they have done wonders. But you need to have strong determination for it.
Yeah, that is very sure. For being healthy, we need to be determined, obviously. And now we have already taken your half an hour, and looks like you are still at your hospital.
Yes, I have a patient to attend now.
Yeah. Oh my God, she has her patients waiting, guys. So we wouldn't take much of her time. And thank you. On
Not
a
a
weekend, you stayed back so long. Thank you so much. Our heartiest thanks to you, Absar, that you
well said
came.
to the listener.
Yes, and they are very happy because now they get some important time frames. Because when we read on the internet, this is a vague idea. We don't know,
Yes,
but you have told very important time frames that if this does not happen within these months, look for a doctor. If this not happen within these months, and most important thing you said is that infertility is not caused only by PCOS, and even if it is caused, it is most treatable. So this is
yeah,
what women want to hear, right? Because that is what is important.
one
And
more
so much thank you, Miss. Yeah.
I don't want to miss is whenever there is PCOS, you have to get your glucose test done at least
Yes.
once in 6 months or in a year. I mean, it's not that just a sugar test. You have to get the glucose challenge test, wherein 75 gram of glucose is given to you. You have to drink. And so this is the glucose challenge test is always recommended, 100% recommended for the patients with PCOS because they can develop either pre-diabetic like condition or diabetic like condition. So when you know, you should be knowing it when you are developing it. And if you control it, this, I mean, if the weight reduction, uh, because of the weight reduction, even those sex hormones, the testosterone level will come down. Automatically, it will come down. Also, you are delaying or stopping diabetes. So
Wow.
the diabetic, what the diabetes may, it's not the level of sugars, matlab 300, 400, that is not causing the problem. The number of years you are having this diabetes with you,
Mhm.
that will cause more
Exactly.
complications. So you
Why,
can,
why, why problem?
I mean, you can just delay the onset of diabetes.
Yes, exactly.
That is what I'm saying.
Yes, very true. She gave such a vital piece of information about glucose challenge test. So जो भी हमें सुन रहे हैं, if you had a history of PCOS or you have it, you're under medication, please take this information and make use of it. So that her purpose of coming here and our purpose of taking 30 minutes from her valuable time get solved. So now, thank you so much, Dr. Absar, and we say good night to you and all the best as you are
Thank
treating
you.
all your patients in such a nice way. And thank you so much. I will just catch up with you later. And Dr. Absar has left because of, her patients are waiting. And guys, she told very clearly about diet and lifestyle modifications. So that I will talk about being a nutritionist and a wellness expert. I will talk to you about what diet and lifestyle modifications we can do about so that maybe your teenage daughters, maybe your sisters, your wife, you yourself, your friends, all of you can get protected from this disease. As she is telling, it is very much manageable. We can manage it, but yes, we have to be careful. And she is telling awareness is the key. That is the whole idea behind doing this every live, and so that you are aware. All the women in my I don't say like to say them client, but the women I am working with for their weight loss, this cases, PCOD cases, I see at least 40 to 50% of time. And most of the time is a misconception that मुझे PCOD है मेरा weight loss नहीं हो सकता. This is the reason I had invited Dr. Absar to talk about it. I hope you got some hope and you got some key takeaways on how to act, how to be aware, and lifestyle interventions and the diet. I will keep talking about in next Saturday live, maybe Friday. I don't know. I'm yet to decide because, but Saturday or Friday, I will definitely meet you all and I will keep telling what exactly you need to do. One question, my friend, she asked, how can we protect ourselves from the chemical food? It is possible to do so, and I will keep telling you about it in our next live sessions. Till the time, keep watching, guys, and please do share with this post with your family and friends so that they can also get benefited. So I think this is how we can create a sisterhood and we can uh, make each other aware, and together we all stay safe. That is something we have seen, right? So now thank you everybody for the wonderful comments, and thank you for watching us. Now I am signing off from on behalf of Game of Thrones team, and we will see you again on next week with another topic. By the time Tuesday again, we will be bringing someone with a success story who have lost their weight and they want to share their secrets with you. So good night everyone, and here I go.